Finally, my pleasure today to introduce Chip Hart. Most of you already know him, but he is PCC's Director of Pediatric Solutions. Chip, take it away.
All right, let me see here. Oops, sorry, I don't have my video yet, and I have to share my screen, right? All right.
Yeah, it looks better.
Yep, so much better. Now, first of all, I don't know if anyone watching is familiar with what it looks like when you raise mushrooms. I don't know if you've ever seen like a mushroom farm, but I feel like that's what's happening with my hair. It looks like it's growing. I'm growing fungi. So maybe what we should do is start a fundraiser, see if I can get my hair cut this week. I have 60 minutes to go through a course that normally takes me about 60 minutes to go through. But with the addition of some of the COVID commentary, I've got at least an extra 20 minutes to try to cram in here. So I am going to go really fast because that's my nature. I'm going to go super fast, and we're going to come up with, we're going to make this, what was I going to say? We're going to work really hard here to have this be finished in the time frame that we're talking about. So let's see how I do. All right. So just for Q&A, everyone already should be on the live session. You must go into the UC chat and put your questions in the live session if I'm going to attempt to answer them, if Alex and Jan are going to help us if I miss them. So put your questions there, please. The goals really quickly are this. We're going to review the importance of preventive care recall. We're going to examine related performance measures, and we're going to evaluate tips and best practices relating to recall. Here's something really important. Many of you have already been to my lecture about this, okay? It's not a lot of this shouldn't be a surprise, but there are still many PCC practices who have not gotten their heads around this incredibly important facet of running their businesses. I was just working with one of our CAs this week who's working for a client of ours who's suffering during COVID due to issues of patient volume, and their well visit coverage is shockingly low. They're in the bottom 10% for PCC clients, and the question leads to the question: well, what are you doing to bring your patients in? Well, they don't want to come in, and that is exactly what we're going to, that's the wall we're going to break through to today. So let's hammer this really quickly. Why am I talking about recall? And why am I talking about recall strategies? Because this is what's going to save your practice during COVID. I gave this lecture even in the good old days before COVID, okay? And I have to start by driving everyone to the importance of preventive care. So I'm going to hammer through this and we're going to take a look. But why am I going to talk about preventive care? Because preventive care is the easiest thing to recall your patients on. Everything else that we talk about that isn't necessarily preventive care, chronic disease management, for your asthmatics, for your obese children, for the kids who need mental health work, the process or the way that you do your preventive care recall is essentially identical to your asthma recall or your obesity recall. In fact, if you think of well visits as being a form of a chronic disease that you need to check in on regularly, it makes it a little bit easier to follow. But let's start right here. Why are we going to focus on preventive care? Because preventive care pays well. Preventive care on average pays about 2 to 1 nationally when you consider all the work that's happening in the visit. Now, of course, during COVID, you're not able to deliver all of those procedures necessarily, but obviously for those of you who live in a state where you can do a preventive care visit, I would rather do a preventive care visit paying half of what you might normally generate for revenue than to do nothing at all, and most importantly, to get in touch with those kids who are not in touch with you presently. Okay, that's one reason to work on preventive care. Another reason to focus on preventive care, it's a measure of a really well-run practice. We've known at PCC for a long time that there is in fact a correlation between those practices who have high clinical performance and those practices who have high financial performance. The discipline to be good at your clinical response is very similar to the discipline about running your business well. It is incredibly rare that we have a high performing practice in one category that doesn't also perform well in the other. And in fact, you can see right here from my chart some items, some clinical things that have particularly high correlation with a practice that does well at seeing their well visits, okay? Why else do we want to focus on preventive care? We need to understand that preventive care fills your schedule. All right, this could be my leading slide in the time of COVID, okay? But back in the good old days, the story I would always tell here is you can't recall a kid for the strep throat he's gonna have in 2 weeks. You don't know. And the only way to balance the ebb and flow of pediatric demand is to manage your demand and fill those slots in advance. This is what your dentists do. This is what your hairdressers do. This is what your vets do. All right, if you want to know how to make money, watch what the hairdressers do, watch what the vets do, and watch what the dentists do. Pediatricians are just kind of happy when their patients show up. You've really got to lock them in and make them start feeling bad if they haven't scheduled their appointments already. Okay. Why else are we going to focus on preventive care? Whoops, Alex, did you have
Chip, I'm
something?
going to jump in.
Yep.
Your slides are not changing if you've been trying to go forward on them.
No kidding. I've definitely been trying to go, and they're changing on my screen. So let's take a moment, Alex, if you don't mind, and let me catch up to you. So bear with me, folks. I think I know what the problem is. All right. Are they changing now?
Now they are.
All right. Guess what happens if you look at your presenter view and change your slides there? Nothing. All right, here we go. So really quickly, for those of you who wanted to see stuff, okay, here are the slides I was trying to show you. Okay, so previously, a minute ago, when I was talking about the measures of a well-run practice, if you take a look in the left column, the practices who have strong well visit coverage, they do better in terms of missed appointment percentage, HPV coverage, infant developmental screening. Those should be no surprise. But how about AR days and the percentage of AR over 60 days? Revenue per visit, RVUs per visit. The practices who do well at well visit coverage have a better E&M distribution. They're particularly good at ADD follow-up and adolescent depression screening. All right, this was my slide about your schedule. This is where I am now. My apologies for that challenge. All right, so preventive care expands the value to your customer. This is really important because right now, to many of your families, a visit to your practice is worth the price of a copay. If you ask a mom, well, how much is a visit worth to the pediatrician? She'll look at her card and say $25 because that's the price the payers have put on it. All right. Preventive care is your chance to reestablish the relationships that you have with your families and return to being the trusted messenger and provide a medical home. This is a vital lesson in the time of COVID. Who else is reminding your parents that wearing masks in public and social distancing are important? They are seeing a huge amount of nonsense on TV, on the news, on Facebook. You are the ones who are important, all right? And here's the thing. So right now, your families, anyone who's pushing back about coming in your office, their values and are really screwed up, and you need to educate them. The cost of coming to your practice is the equivalent of probably dinner for two from KFC. That's why that KFC thing is up there. They pay more for Netflix every month. They pay more for their iPhones and their unlimited data. And you're the one who's actually maybe saving their child's life. Maybe not all at once in one day, but incrementally over many years. You need to return and get your patients to understand the value and impact of what you're doing for them. All right. Another reason to focus on this, it's a pay for performance measure, and you are all still getting those payments. If you're a PCMH practice, you don't have a choice. You already know that, but you're likely, many of you do get pay for performance payments from your payers, and they are desperate for you to maintain those scores, those well visit scores, those vaccine scores, because they are often paid for the state or get paid from the state or get their own bonuses for this. All right. Why else are we going to focus on this? Because it's good for society. It's why you do this job. All right. I gave you two links right here. There's one, chronicdiseaseimpact.com, or you can go to the Milken Institute. All right. Look at this quote. We could reduce the economic impact of a disease by 27% or $1.1 trillion annually. We could increase the nation's GDP by $905 billion linked to productivity gains. We could decrease treatment costs by $218 billion per year. Lower obesity rates alone could produce productivity gains of $254 billion and avoid $60 billion in treatment expenditures per year. This, who forgot to put a quote marks at the end of this guy right here? Sorry about that. The bottom line is All right. That is your work right there. This is incredibly important. And we've all seen the PPP money that went out. Just your work could cover the PPP money for the country. That's kind of crazy. All right. Sorry, back to my slides. Let's review. Preventive care pays well. It's a measure of a well-run practice. It fills your schedule. It expands your value to the customer. It is a pay-for-performance measure, and because it's good for society. Those are pretty good reasons to do it. But, all right, this is the real reason you need to do it. It's good for your patients. How many times has anyone here who is a clinician spotted scoliosis, a hearing disability, a vision problem, an eating disorder, spotted a neglected or abused child, or any of the dozens of developmental issues that your screenings are designed to catch? How many times have you done that over your careers? Your preventive care is the fundamental and most important clinical result that your work delivers. It is crucial. Everything else you do in peds can be stolen from you by the minute clinics, except for this, okay? How many times in the last year have you spotted a kid with a problem and said to yourself, and gotten angry actually, and said, I wish this kid had come in last year. I could have done something about it. Well, that is your reason for being a pediatrician. And this is what motivates all of my clients who I know. This is what makes you get up in the morning. And that's why you should be focusing on it. But guess what? This is where I used to end my slides. Now I need to talk about this. It's even more important during COVID. It's because preventive care's normal benefits are amplified right now. Every single time that you have a kid who misses an appointment with you, it is a bright futures evidence-based opportunity that you've missed. All right. You are the front lines for taking care of kids in the United States right now. And every time one of your kids, because of COVID, misses a well visit, you're missing a chance to spot vision, hearing. You're missing a chance to see something relating to height and weight and dental health and depression and ADHD and a lead screening. Okay. You are say it right here in the second line. You are the people who identify abuse and neglect. The AAP right now is telling you to see these patients. Unemployment uncertainty with 38 million, maybe 40 million people having applied for unemployment right now. You have to race to see them while their well visits are still covered, while they still have health insurance. Now is the time to see them. For many of your families, all right, a trip to the doctor's office is the most exciting thing that will happen to them this week. And they don't have interference with camps and work and school and everything like that. Now is a good time to see them. When the time comes and different parts of the country are opening at different times, but as we reopen, because you're already 2.5 months behind seeing so many of your well visits, you will not have enough space in your future schedule to see everybody. You need to get that volume of people who are overdue down so that you don't fall farther behind. And maybe most importantly, that when a COVID vaccine is ready to be delivered, you need to be there to continue to provide care. You are going to be the distribution mechanism for the United States to getting kids immunized. And when the country opens back up, you have to be there. Pediatricians are vital, not just to the health of the kids in this country, but to the health of the entire country. Now, I wrote a big blog post about this, and some of these points here from my friends here at PCC, they gave me some good ideas. But there's my blog post down below. You can go take a look at it later and get much more detail on each of these items, okay? So how are you doing right now? Well, here is a slide that from a talk I gave for the Academy, AAP 2 weeks ago, 3 weeks ago. It is for a benchmarking class I was giving, and this is a view, of a graph of the distribution of well visit coverage nationally. So let's take a look at that yellow line. That yellow line is the median for well visit coverage nationally. So what that means, take a look at the number right in the middle, 76%. So the median PCC practice has 76% well visit coverage for kids between the ages of 3 years and 6 years. Now that blue line at the bottom, that's our bottom 10%. So 10% of our clients have a coverage rate of 57%. And you're like, oh, 57%, that's more than half. That means 43% of the kids between the ages of 3 and 6 have not been in for a well visit for a chunk of our clients every year. Okay. Go out to 7 to 11. 7 to 11 is the the fastball down the middle for pediatricians. That's your bread and butter. The median. All right. So think of you, the people who are on this call, the median. These aren't just pediatricians nationally, because we know that PCC clients are extra cool and do a better job. So nationally, this number is worse. But 68%, 32% of your patients between the ages of 7 and 11 haven't been in for a well visit this year in the last 12 months. That is gigantic. And that's the median, okay? If you want to be in the bottom 10%, which 1 out of 10 of you on this call is, you're below half. This is painful, all right? So when our clients are calling us and our CAs are working with them and they're like, oh, my visits are down 80% or whatever, guess why? Because you're not doing your well visits. You're depending on runny noses and diaper rashes and things that can be Googled now. This can't be Googled. And what we've also seen, let's be clear, this is the sick to well visit ratio. Well, we track it, we go back further than this, but look at going all the way back to 2003, it has plummeted, all right? 2.66 to 1, all right, is almost a 3 to 1. That means almost 3 out of every 4 visits. Okay, so it's 2.6 out of every 3 visits are sick visits. We're down to 1.5 right now. And so the reason for this number changing is that we've been yelling at people, and vaccines work, okay? Pneumococcal and meningococcal have kept a lot of kids out of your practices. And it's also with high deductible health plans and a few other things, we are seeing that people are not necessarily coming in for things that you can't do anything about, like 100-degree fevers. So you have to pay attention to your well visits. So now I'm going to pivot. Here I am. I'm going to talk to you now about the effective tools. And I'm going to walk through them. And now some of these are old school, and that's because I'm starting at the bottom. I'm going to start with the things that everybody can do, and then I'm going to move into the cool stuff. All right. So this right here, this is a snapshot of a dentist postcard. And I use this because a lot of people still think about this when we talk about patient recall, getting that postcard in the mail from your dentist telling you it's time that you call and make an appointment. Guess what? If you're not doing anything right now, which is these people right here, I don't know if you can see my mouse, I don't think so, but if you're on the blue line, okay, for 1 out of 10 of you, this dentist postcard right here is like a revolution. All right, if you're ahead of this, great, you can be cool today. But right now, for at least 10% of you, and frankly, it's probably like 30 or 40% of you, you're not even doing this. And this is effective. All right, what else is effective? Picking up the phone and calling people. Do you not have a number of employees who are not fully occupied right now? Hand them a list of your patients and tell them to pick up the phone and call. You have PCC system. It is 2 button presses to get a list of your kids who are overdue. We're going to talk about that in a minute. Hand them to your nurse, hand them to your front desk person, hand them to whoever in your office is not doing work right now. Have them pick up the phone and make a personal phone call and get them in. All right. I'm going to talk about our cool tools here. Our cool tools in a second, but you don't need cool tools. You need the connection. So another thing is here's a screenshot of Notify. All right. Many of you have and utilize these tools. You can send them emails. You can send them text through Notify. There's an expense related to it, but the payback is giant. That looks pretty slick. Or you can go right to this link right here, or you can go to learn.pcc.com and just search for batch messaging. And we have given all of you for free a tool that allows you to go right to the broadcast messaging patient list. And you can say, I want a list of all the 8-year-old boys who are overdue for their well visit. And you can go tap, and it will text them or email them. And it doesn't cost you anything. It's all right there. There is no other vendor who I'm aware of, all right, who has offered anything like this. And we are offering it to you for free. All right. I'm going to tell you right now, if you are not on the yellow line or higher, if you're not in our top, if you're not above the median, if you're not above the 25th percentile, if you're not above the 10th percentile, or let me reverse that, the 75th percentile and the 90th percentile, if you're not in those good batches, how come you haven't turned on broadcast messaging yet? It's free. All right, let's keep going. Whoops, sorry. Let's keep going. Another one Another really, really effective tool for scheduling is you, the doctor. When you have a patient on the phone, and more importantly, when you have them in your exam room, you need to look them in the eye and say, hey, glad we had this well visit. We got to talk about this and this and this today. I'm about to push some stuff out through the portal. Make sure you schedule your next well visit. Things are going to be backed up. Things are going to be hammered a year from now. We're going to be in big trouble. Get your well visit in. I expect to see you next year. Okay. Every one of you who goes to a hairdresser or brings your dog to the vet or your cat to a vet or has a dentist knows how they build in the expectation for every single person who goes there that you will be coming back. And that's something you need to do yourselves, okay? Now, a couple of my slides here are specifically referring to things that you can say in letters, because your discretion in terms of putting information in a mailed letter to your patients is a lot broader than it can be in a text or a phone call. And that's because of HIPAA, and that's because of some FTC rules about contacting people. I'm going to talk about the things that you can do in a letter only because it's still a perfectly viable way to get in touch with people. When you're sending a letter, okay, personalize your letters. Make your letters age, sex, and language specific. If you have a cohort of Spanish-speaking patients in your practice, send a letter in Spanish, or send a text in Spanish, or send an email in Spanish. You can, without giving away PHI, all right, you can send an email to your patients saying, hey, this is just a friendly reminder that any patients who are soon turning 16 and hoping to get past their driver's test need to have an annual physical. There you go. All right. You didn't give away PHI. And if that gets delivered, hand delivered to those families of 16-year-olds who don't have their well visits yet, they will be grateful. Okay. You do not want any of your patients to be refused school in the fall, okay, being because they didn't finish with their immunizations. I mean, you've really got to watch for that. And here are some examples right here. I'm enjoying, or that's the wrong word. I'm seeing really great feedback from our clients when they drop the patient's names in there. But you can only really do that when you're sending out letters. You can't do it when you don't want to do it necessarily when you're texting or emailing, because you don't know for sure who's receiving it. At every opportunity, you should be marketing your practice. All right. So if you're going to send out letters to a bunch of your families saying, hey, your son Steve, he's overdue for his 15-year-old birthday for a 15-year-old well visit, or your daughter Katie's due for an 18-year-old well visit, whatever the case may be, you can, on the back of that piece of paper, tell people things about your practice. Hey, we want to welcome Jane Mulligan to our practice. She specializes in adolescent girls' physicals. Don't forget that we're still open every night until 8 p.m. and on weekends. All right. The fact is, you know this, for everyone here who does after hours visits, you have patients routinely go somewhere else after hours, and you've been announcing your availability for 2 years. You'd have to keep doing it. Okay. So use those opportunities. All right. What else can I tell you? Set expectations and improve care. Save time. Please complete the attached form for your son and bring it with you to his next visit. Please review the enclosed information and prepare your most important 2 or 3 questions to ask the physician. Visit our website and download a copy of the anticipatory guidance we distribute at every visit. You can put those messages in the pre-visit communication that you have with your patients. There's no reason you can't do that. All right, some more tips. Change your tune. If the example I always used to give was, hey, if you've been sending out postcards for the last 20 years, the next time you go print up a batch, change the color from white to fluorescent yellow. And if you've been using fluorescent yellow, change it to fluorescent red. If you're on fluorescent red, change it back to the white. You want something to show up in their mailbox that they haven't seen before, that makes them stop and look at it and say, oh, what's this? If you've been using postcards all along, maybe switch to a letter. If you've been using a letter, you can use Notify or a free messaging tool, and you can email them and text them. If you've never texted them, now's the chance. If you've only texted them, maybe try an email. Change your tune. There's a reason why ambulances, the siren changes tune for that same reason. We want to catch our patients off guard. We want to make them stop and look at something and actually engage with it or ingest it. So change your tune. All right. Some other advice, you can't recall them all. Now, if I looked and I saw a bunch of people on this call and I knew who they were, I could pick on someone specifically, but I will guarantee you that any practice here with more than 3, 4, 5 doctors will have hundreds of patients who are overdue for their well visits. All right, hundreds. You can't possibly see them all. Since you can't possibly see them all, pick the lowest hanging fruit. Now I'm going to be mercenary. And I'm going to say the lowest hanging fruit is the payer who pays you the most. Now, you know these numbers are made up because United Healthcare and Oxford are the highest payers, so you know this is bogus, all right? But right here, I would begin by recalling UHC and Oxford Health because those practices pay the most for those well visits. And I'm not suggesting this because I want you to go out and get rich. I'm saying that you take this money and plow it back into your practice to make it up your practice response better. You want to pay for those for those better invites, those better mailings. You know at some point, I presume the broadcast messaging might have a cost. Great, take the money and plow that back into it. You want to be open after hours. You want to hire some nursing staff to make your well visit process easier. Great. All right, take that money and plow it back into this. This is where I'd start, but maybe you don't like my mercenary answer. Okay, so since you can't recall them all, why don't you start with the kids who need the recall the most, the kids who haven't been in the longest to your practice, because you need to take them off of your practice roles if they're not going to come in, or maybe it's a teenager who for whatever reason hasn't been in 2 or 3 years. Those are the kids who probably need to come in the most. All right. Use technology. Take a look at this first item right up here, okay? Do you see, this is a screenshot straight from Partner. Do you see how it says your last physical and your next physical is due? I will tell you right now as a benchmark, if you look at your appointment book from yesterday or from 2 or 3 days ago, and maybe it's not true during COVID, but it was certainly true pre-COVID, that about 15% of the kids who walk in every day, the kids who have sick visits, are overdue for their well visits, and so few people supersize them. So right now, given the safety and security issue of bringing people into your office, if someone comes in for a sick visit, pardon me, I'm sorry, for an acute visit, and they're overdue for their well visit, do it now. Now is your chance. You have a chance to immunize them. You have a chance to screen them. You have a chance to do a vision and a hearing because they might not come back in 2 weeks or in 2 months. All right. And down below that, I had the opportunity to do a webinar with Barbara Howard from Chattis, and she has this great piece on leveraging patient input tools during COVID. Use technology. That's a big piece of advice I have. All right. So here's another one. Meet the scheduling needs of your customers. Be open when your patients need you, not when it suits you. You are a service industry. You exist for your patients. Your patients don't exist for your pleasure. You exist for theirs. I was working with a practice the other day, not a PCC client, where one of the partners wants to close the after hours right now because he's just tired of seeing patients after hours. They have a major patient volume situation. They, obviously those people who are still able to work are not going to be leaving their office right now or leaving their jobs to bring in someone in for a well visit. And one of their partners who totally doesn't get this is like, we're coddling our patients too much. They'll make it into our office if they want to. That could be not less true. So you need to look up and figure out when is it that your patients actually want you there. Use nurse practitioners if you have to. I don't care. You have many, many patients who would see you after dinner, after 6 o'clock, 7 o'clock, 8 o'clock, if you are available. Think about doing that. The other thing is I like to remind practices to tell their patients over and over again that it's perfectly reasonable when your kid reaches a certain age that you switch doctors in the office, because I know too many people who are too embarrassed to call their practices and say, hey, you know what? My daughter doesn't want to see Dr. Steve anymore. She'd like to see Dr. Amy, okay? And a lot of them are so embarrassed by that interaction that they will actually leave your practice rather than confronting you. So tell your patients, hey, we love it if you switch doctors within our office. Pardon me, we want to be your patient-centered medical home. Don't leave us, and we will find a place for you. So that's also more advice. Every single patient who walks out of your office should know when their next appointment is, period. You should never have a patient leave your practice without having scheduled the next appointment. There's no excuse for it at this point. I will tell you, I think it's in my next slide. Yeah, right here. I measured this a couple years ago, and I wrote 2 blog pieces about it. And one of them was actually the second one, Tips on Building Pediatric Practice Revenue, 3 Summer Success Stories. So 2 or 3 years ago, I remember I had given this very lecture, and I noticed that 3 of our clients had huge improvements to their well visit coverage after the users conference. So I called them up, and I was, because I wanted to write a blog post about it. So I said, hey, what did you do to really improve your well visit coverage? Did you clean up your database? And 2 of the 3, without prompting, said, Chip, we listened to your advice and we opened up our calendar a year. And you see that chart right there, those 3 lines? You notice that the 3 lines start low, like that blue line starts at, let's call it 63%. And by the time we get to the end, we're almost at 90%. You don't have to know what this chart indicates. I will tell you. The bottom line is that because there is a positive slant to those procedures, I can tell you that those clients are not, or those clients have seen that the further out you schedule a patient, the higher their well visit coverage is. Our clients who schedule out a year, who schedule that well visit in advance, have on average a higher well visit coverage rate. There it is, right in the numbers. Now, these are some other slides that I've used in the past, okay? Or that I'm just going to hit through them here, and then I'm going to talk about some COVID things. Change the expectations of within your practice. You need to begin at the top with yourself. This needs to be part of your culture, but you also need to tell every single person in your office, like if you have a policy that says every patient walks out with the next appointment, you need to make sure that every single person at your front desk schedules the next appointment. And if they ever talk to someone who just owes you money or who is trying to get some questions answered or trying to sign up for the portal, and they notice that someone doesn't have a well visit scheduled, then you get them on your appointment book, okay? Maybe reward physicians who produce more well visits. Maybe that's part of your compensation model. Require patients to schedule their well visits at the time of service, which was the example I was giving you right there. Use your benchmarks, your sick visit ratio, your immunization rates to measure your progress. If you are actually making changes to your practice, it's really, really cool when you see, wow, our sick to well visit ratio dropped. Our immunization ratio improves. Our well visit coverage improved. It's all in your dashboard. But when you go back to your partners and say, hey, guess what? We made these changes and our well visit coverage improved from 68% to 78%. You've now got a story that really has value. All right. And ultimately what you want to do is you want to get to a process where the recall process in your practice is as automatic as doing your weekly billing. And what I mean by that is just as someone every week hits a button, prints out claims for the people who are 120 days, the people who are 60 days, whatever the case may be, in that same batch is when they should be tapping a button and sending out recall notices to all of your patients. All right. However, how am I yawning at my own talk? That's crazy. That means I have to not be boring. Uh-oh. All right. During COVID, here are some special suggestions. Inform your patients of your practice's new safety measures. Has every single person on this call reached out to their families to explain, you're here, I'm here, we have PPP, this is how we're doing well visits, this is how we're doing sick visits. If you have not, you should immediately when you get off the call, fire up broadcast messaging with PCC and send a message out to everyone explaining to them that you're available and this is what it looks like. All right, what else would I suggest to people? Think about adjusting your workflow. Some practices or some visit types, for example, are really popular already with telemedicine visits. So maybe your recall messages should be driving some visits to telemedicine and some visits to in-person visits. You may need to adjust your workflow to reflect the different types of places that you want your patients to end up. Now is the time to work on that, all right? Before you do broadcast messaging and send out a message to 1,000 or 3,000 or more patients, Clean up your patient list. This is really, really important. We have too many clients who have practice or patients who are 18, 16, 17, 18, 20, 21 years old and are not actually active in the practice, or they've moved, or the worst is deceased. Make sure that you get all of the patients out of your practice who no longer belong before you do some of these batch messages. And create a library of resources and links for your patients and families so that when you get in touch with them, you can actually leave them with a link on your website that they can go read that will explain to them the importance of the service that you're attempting to offer them. All right. Now, one of the things that I cannot stress too much is targeting specific patients and needs. Okay. You should be doing recalls for patient well visits and for kids who have overdue vaccines, who are under 2 and who are overdue for their adolescent vaccines, and who have overdue vaccines in general that are going to be needed for school and daycare required. You can go to your dashboard and see where you stand on these things. You should be recalling kids with high BMI and for obesity management. You should be recalling them for depression and anxiety, for ADD, for asthma, for kids who need care plans updated, for referrals. That's what you should be doing. All right. I have 1 or 2 secrets, and then we're going to take some questions. Oh, have I been looking at the live session? The answer is no. I haven't looked. Oh, I see one thing I'm going to talk about. And I see a couple people saying, hey, I'm really excited about broadcast messaging. That's great. Okay, I'm glad you're using it. But there are people on this call who are saying to themselves, what is he talking about? All right. Go to learn.pcc.com and go to broadcast messaging. All right, here's a slide. I don't want you to have to try to pay attention to the details of it, okay? It's just, it's up there as a place marker. But one of the things I really, really want to emphasize is the idea of tracking and measuring your results, comparing methods, and then use more than one method to get in touch with your patients, okay? So let's do a little bit of evidence-based practice management. What this is here, this is a screenshot of a spreadsheet that one of our clients made. He sent it to me to say, hey, and you can see how long ago. This is 2018, so it's 12 years ago. He said, yeah, we whenever we send out our recall notices, we track how often or what the response rate is. And I'm just going to tell you right here, if you look at the middle blue number where it says 21% right in the middle of the column, okay, they had a 21% positive response rate the first time they sent out a letter. And then to the same batch of patients, eliminating the people who had already positively responded, they got a 43% response. And there are 2 things to realize here. Number one, every time they're sending out this letter, they get hundreds of responses. And pardon me, they got a 21% response the first time, a 22% response the second time. So they should keep sending this letter out until the costs of sending the letter are greater than the revenue that they generate from getting those kids in. All right. And obviously a 20% response rate to all your overdue kids is pretty gigantic. But did you notice that in the second time they sent the letter out, the response rate was a little higher? Now, maybe they changed messages. Maybe their patient base, or maybe they changed. Maybe their patient base didn't, I don't know what else it would be. Maybe they changed letters. Maybe they need the second poke. Maybe they used a different format. All right. Maybe they sent a letter the first time and they sent a text the second time. The fact is, you would, even if they'd only gotten a 10% response, they would still keep sending, but they more than doubled their response here. That's gigantic. That's crazy. All right. So some takeaways before I go to answer questions. I went super fast because I was afraid we weren't going to get to the end. But some takeaways here. Every practice has gaps in care where they can meet patient needs, whether it's the kids who need care plans, the kids who need obesity management, the kids who need, right now, with a 10% expected positive rate on depression screening, you can presume that number's, doubled. And if 20% of your teens have evidence of depression right now, shouldn't you be on the phone with as many of them as possible? So that's something you should think about. Our tools make this process easy. You have no excuse from a technical perspective right now. And the practices with the highest rates of well visit coverage and the practices who are doing the best in the COVID, in terms of a COVID response, have persistence and effort. Those are the 2 things they have in common, not luck or money or anything like that. It's just persistence and hard work. All right. Does anyone have any questions? I'm looking right at the ideas right there. I know Robin Warner, she did mention gamification. She's absolutely right. If you can turn this into some sort of contest for your patients, or you can give them some positive feedback about being responsible for their well visits, that also has a profound effect on the impact. All right, I'm looking at the live session UC. Does anyone have anything they want to chat about? Anyone have a question? Anyone have good advice? Does anyone have something they want other PCC employees or customers, pardon me, to know? This is your chance to speak up right now or forever hold your peace. Oh, there you go. Us also. Massive broadcast recall message, and the phones rang off the hook. That is gigantic. If you are on this call or you're listening to this tomorrow or in 3 days, and your practice is suffering with volume issues, this is the key. This is probably the single biggest topic I can talk about. And it's remarkable to me how many people don't take advantage of it. All right. I could go take a look and see who's on the YouTube video and start posting dashboard results for those practices. Don't worry, I won't do that. But this is the difference between generating revenue and delivering important quality care to your patients and not. All right. I guess in a way, I guess I'll ask my bosses, Jan and Alex, if we should sit here for a minute or what we should do. I'll do whatever. What is going on with me that I'm doing these webinars at like warp speed?
Seeing it looks like somebody was typing in the live session, so
Yep,
moment or two.
I will give a moment or two. No pressure, Sue. We're watching you. I knew who it was. All right. Does anyone have any questions? You know what I'm mildly afraid of is that the people who are taking the time to watch this right now are also the people who are in the 75th or 90th percentile in terms of well visit coverage. And these are not the people we need to be talking to. I'm just going to say, if you are one of those high performing practices, keep it up. I hope you got one single idea here about that you can manipulate for your practice. I'm going to go right back to this list right here, the targeted specific recalls. Okay. Oh, I like that. Add the office phone number in the text so they can hit the number and call right away. Killer. Sue, I'm going to add that to my slides. Look at me right here. Ready? This is me. I don't know if it still shows.
It does.
All right. I'm making a note because I'm going to come back to that one. Okay. I want to do it with, I'm going to do it here. Okay. The layout's bad. This is just a note for later. Add phone to texts so they can press and contact. We all know what that means right now. Sue, you get a gold star. Or actually, according to this, you get a green heart. There it is. Well done. All right. Does anyone else have any bright ideas? Anything they want to share? Anything that's improved their well visit coverage? Speak up. Or it's not even their well visit coverage. Technically, it could even just be things that have driven patients into your offices right now. You know what? I'm maybe we should ask the UC bosses, but maybe we should give awards for the people who give the best feedback and most suggestions during the live chat. I'm appreciative of certainly the clinicians who are able to take the time out to come to this. I think it's going to be really hard right now to watch our stuff live. As a new client, we're working hard to clean up our patient list, broadcast messaging with text and email, and a lot of phone calls. Thanks for all the great advice. Well, thank you for being cool. All right. There are ways, by the way, our crew can help you when you're cleaning up your patient list. There are cool things that we can do to help you identify those people who haven't, who might be falling off the radar. I'll tell you, for example, the sort of nerdy things that I would do. I would run some of the recall lists, and there are a couple different ways you can do it. And I would go through, for example, I might go through all of the different people. I might run one of the lists through the EHR or through the recaller, dump it into a spreadsheet, and look for every single person who doesn't have a viable address, or doesn't have a viable email, or doesn't have a viable cell phone number, because you might want to mark those people as no longer active. And if they are active, then you want to get that information ASAP. If let's just say, for example, that you're really big on sending emails, which is awesome. You could generate a list of all your active families, or maybe even just your, target a group, all the families with boys between the ages of 10 and 13. You could generate that list, have it in a spreadsheet, and then have your staff call every single one of them who does not have an email listed with your system. So that the next time you go to make a recall, they're all right there. All right. We have practices asking us all the time, well, I want to get, I want to be able to spend all my PPP money, and I don't have anything for my staff to do. Cleaning up these lists is one of the best uses of your staff time right now, period. All right. Anyway, does anyone else have another question or comment for me? I see, Jan at PCC is talking. Jan, come on. Help me out. No pressure. You ever notice that when you're the person typing in the window, you feel like you're typing a million miles an hour, but when you're waiting on someone, it says someone's typing, and then you get like, yes. Jan's got to finish her thought. Oh, perfect. Tommy Angel, you're now becoming my new favorite, new customer because you're funny. All right. Jan. We should edit this part out, to be honest. Now, I did move my screen, by the way. I don't know if people can tell, but I did move my screen so it's above. It's a little less disconcerting than looking over there, right? I mean, I don't know what you think, Alex. Like when I want to see my screen, I'm looking up as opposed to left or right.
I think that looks better because it looks better than what I'm doing right now, which is looking to the side,
right? Yeah,
where everything is.
Yeah, but however, looking up makes my professional mushroom head go the wrong way. All right. Jan would like to thank everyone. Please be sure you complete a course survey here so we know how we're doing. Is there any way for the people at PCC to know that I filled out my own course survey or no?
The wrong person asked that question.
Yeah. I'm going to go fill out my own course survey. Brilliant, handsome, smart. No. All right. I want to thank everyone for their time. And if you have any questions about this, contact your CA. And if you and your CA have any questions, contact me, Alex, Jan, or Tim. We're glad to help you anytime. Thank you, everyone. Have a good afternoon.
Thank you, everyone. As Chip said, please fill out the survey that Jan linked. The recording of this session should be available in a few hours once YouTube processes them. Thank you again. We'll see you at the next session.
Toodaloo.
Have a good afternoon.